Action Oriented Therapies, or cognitive behavioral approaches. As outlined in Gerald Corey's Theory and Practice of Counseling and Psychotherapy, these are the following therapies: behavior therapy, cognitive behavior therapy, and reality therapy. Key figures of behavior therapy include B.F. Skinner, Albert Bandura, and Marsha Linehan. This approach applies the principles of learning to the resolution of specific behavioral problems. Results are subject to continual experimentation. The methods of this approach are always in the process of refinement. The mindfulness and acceptance-based approaches are rapidly gaining popularity. Basic philosophy of behavior therapy. Behavior is the product of learning. We are both the product and the producer of the environment. Contemporary behavior therapy has branched out in many directions, including mindfulness and acceptance approaches. Key concepts of behavior therapy. Focus on overt behavior precision in specifying goals of treatment, development of specific treatment plans, and objective evaluation of therapy outcomes. Therapy is based on the principles of learning theory. Normal behavior is learned through reinforcement and imitation. Abnormal behavior is the result of faulty learning. The goals of behavior therapy are to eliminate maladaptive behaviors and learn more effective behaviors. It aims to identify factors that influence behavior and find out what can be done about problematic behavior. Additionally, it encourages clients to take an active and collaborative role in clearly setting treatment goals and evaluating how well these goals are being met. The therapeutic relationship in behavior therapy involves the therapist being active and directive, functioning as a teacher or mentor to help clients learn more effective behavior. Clients must be active in the process and experiment with new behaviors. While a quality client-therapist relationship alone is not viewed as sufficient to bring about change, it is considered essential for implementing behavioral procedures. The techniques of behavior therapy include reinforcement shaping, modeling, systematic desensitization, relaxation methods, flooding, eye movement desensitization and reprocessing, cognitive restructuring, social skills, training, self-management programs, mindfulness and acceptance methods, behavioral rehearsal and coaching. Questions concentrate on what, how, and when, but not why. Contracts and homework assignments are also typically used. Applications of behavior therapy are quite diverse. This pragmatic approach is based on empirical validation of results, which makes it highly reliable. It enjoys wide applicability to individual, group, couples, and family counseling. Some problems to which the approach is well suited include phobic disorders, depression, trauma, sexual disorders, children's behavioral disorders, stuttering, and even the prevention of cardiovascular disease. Beyond clinical practice, its principles are applied in various fields such as pediatrics, stress management, behavioral medicine, education, and geriatrics. Behavior therapy has made significant contributions to multicultural counseling. The focus on behavior rather than on feelings is compatible with many cultures. Some of the strengths include a collaborative relationship between counselor and client in working toward mutually agreed upon goals, continual assessment to determine if the techniques are suited to clients' unique situations, assisting clients in learning practical skills, an educational focus, and a strong emphasis on self-management strategies. When we talk about the key figures of cognitive behavior therapy, we must mention the founders, Albert Ellis and A.T. Beck. Ellis founded rational emotive behavior therapy, which is a highly didactic, cognitive, and action-oriented model of therapy. Beck, on the other hand, founded cognitive therapy, which gives a primary role to thinking as it influences behavior. Judith Beck continues to develop cognitive behavior therapy, while Christine Podesky has developed strengths-based CBT. Donald Meichenbaum is also a notable figure in this field. The basic philosophy of cognitive behavior therapy is that individuals tend to incorporate faulty thinking, which leads to emotional and behavioral disturbances. Cognitions are the major determinants of how we feel and act. Therapy is primarily oriented toward cognition and behavior, and it stresses the role of thinking, deciding, questioning, doing, and redeciding. This is a psychoeducational model which emphasizes therapy as a learning process and acquiring more effective ways of coping with problems. Key concepts of cognitive behavior therapy. Although psychological problems may be rooted in childhood, they are reinforced by present ways of thinking. A person's belief system and thinking is the primary cause of disorders. Internal dialogue plays a central role in one's behavior. Clients focus on examining faulty assumptions and misconceptions and on replacing these with effective beliefs. Goals of cognitive behavior therapy. To teach clients to confront faulty beliefs with contradictory evidence that they gather and evaluate, to become aware of automatic thoughts and to change them, to assist clients in identifying their inner strengths and to explore the kind of life they would like to have. The therapeutic relationship of cognitive behavior therapy. In ReBT, the therapist functions as a teacher and the client as a student. The therapist is highly directive and teaches clients an ABC model of changing their cognitions. In CT, the focus is on a collaborative relationship. Using a Socratic dialogue, the therapist assists clients in identifying dysfunctional beliefs and discovering alternative rules for living. The therapist promotes corrective experiences that lead to learning new skills. Clients gain insight into their problems and then must actively practice changing self-defeating thinking and acting. Techniques of cognitive behavior therapy. Therapists use a variety of cognitive, emotive, and behavioral techniques. Diverse methods are tailored to suit individual clients. This is an active, directive, time-limited, present-centered, psychoeducational structured therapy. Some techniques include engaging in Socratic dialogue, collaborative empiricism, debating irrational beliefs, carrying out homework assignments, gathering data on assumptions one has made, keeping a record of activities, forming alternative interpretations, learning new coping skills, changing one's language and thinking patterns, and role-playing. Applications of cognitive behavior therapy. This approach has been widely applied to treatment of depression, anxiety, relationship problems, stress management skill training, substance abuse assertion training, eating disorders, panic attacks, performance anxiety, and social phobias. CBT is especially useful for assisting people in modifying their cognitions. Many self-help approaches utilize its principles. CBT can be applied to a wide range of client populations with a variety of specific problems. Contributions to multicultural counseling of cognitive behavior therapy. This is a collaborative approach that offers clients opportunities to express their areas of concern. The psychoeducational dimensions are often useful in exploring cultural conflicts and teaching new behavior. The emphasis on thinking, as opposed to identifying and expressing feelings, is likely to be acceptable to many clients. The focus on teaching and learning tends to avoid the stigma of mental illness. Clients are likely to value the active and directive stance of the therapist. Key figures of choice theory and reality therapy include the founder, William Glasser, and a key figure, Robert Wobbelding. This short-term approach is based on choice theory and focuses on the client assuming responsibility in the present. Through the therapeutic process, clients are able to learn more effective ways of meeting their needs. Based on choice theory, this approach assumes that we need quality relationships to be happy. Choice theory is an explanation of human nature and how to best achieve satisfying interpersonal relationships. Key concepts of choice theory, also known as reality therapy, focus on what clients are doing and how to get them to evaluate whether their present actions are working for them. This approach, it rejects the medical model, the notion of transference, the unconscious, and dwelling on one's past, on one's goals of choice theory or reality therapy aim to help people become more effective in meeting all of their psychological needs. The therapy seeks to enable clients to get reconnected with the people they have chosen to put into their quality worlds and to teach clients choice theory. The therapeutic relationship of choice theory, or reality therapy. A fundamental task is for the therapist to create a good relationship with the client. Therapists are then able to engage clients in an evaluation of all of their relationships with respect to what they want and how effective they are in getting this. Therapists find out what clients want, ask what they are choosing to do, invite them to evaluate present behavior, and help them make plans for change. Techniques of choice theory or reality therapy. This is an active, directive, and didactic therapy. Skillful questioning is a central technique used for the duration of the therapy process. Various techniques may be used to get clients to evaluate what they're presently doing to see if they're willing to change. If clients decide that their present behavior is not effective, they develop a specific plan for change and make a commitment to follow through. Applications of the choice theory or reality therapy. Reality therapy teaches people ways of using choice theory in everyday living to increase effective behaviors. It has been applied to individual counseling with a wide range of clients, group counseling, working with youthful law offenders, and couples and family therapy. Contributions to multicultural counseling of choice theory or reality therapy. The focus is on clients making their own evaluation of behavior, including how they respond to their culture. Through personal assessment, clients can determine the degree to which their needs and wants are being satisfied.